living in grace. We're very thankful and delighted that you have decided to come to our live streaming or by Facebook Live to another night of living in grace. Tonight, we have with me two guests as we could be talking about the coronavirus and the patient, because we want to know what happens and what should we do to protect our health. First, I have with us my dear friend, Mr. Rick Stevens, who is the president of Christian Hospital and Northwest Healthcare here in St. Louis County. And we have also tonight Dr. Carol Willoway. She is a hospitalist specialist in St. Louis, Missouri, and she is part of the Physicians Group LC, and her current practice location is at Christian Hospital Northeast. So Rick and Dr. Willoway, who welcome you both tonight, as we talk about a subject that I think is very dear to all of our heart, because it's very important for us to get as much information as possible as we will live our lives, okay? Here we go. I have some questions here. First of all, Dr. Willoway, you are a hospitalist. And could you explain to us what that is?
Yes. So I am the medical director of the Christian Hospital Hospitalist Program at Christian. A hospitalist is a doctor that only sees patients in the hospital. So we like to think of ourselves as your primary care doctor while you're in the hospital. So we are treating you. When it's time for you to leave, we provide information back to your primary doctor about why you came in, what we did for you, and recommendations for when they see you next.
Okay, thank you. Thank you. Now, in your position, you've seen a lot of COVID-19 patients. And could you explain to us, how does COVID-19 affects the human body?
It's a really good question. And so, yes, we've definitely seen our share of COVID patients. As you know, North County has been affected quite a bit by this disease in comparison to other parts of the region. And so we learn more and more about the disease every day. But what we are seeing, the primary symptoms that we see are respiratory, so difficulty breathing, because it's affecting the lungs. We also see that it affects the kidneys to the point where some people are having to go on dialysis. It can affect the liver. It can affect the abdomen. So we have people that come in with diarrhea, abdominal pain. So it's not just the lungs.
Okay. Now, what is the average length of stay for a COVID-19 patient in the hospital?
So what we're seeing currently is about 8 days for patients who are not requiring the ventilator.
And if they require the ventilator?
Those patients are staying quite longer, between 20 and 30 days, and the average seems to be about 20 for them.
Okay. Now, there's some things I've heard about COVID-19 when it attacks the body, and especially the respiratory system. Is it true that you build blood clots in your lungs and the lungs harden?
That's another good question. So that's what we're seeing. And it's something different from this virus, from, let's say, the flu or other diseases that cause pneumonia, is they show a particular type of disease. This virus seems to be causing issues because of all types of havoc that it's wreaking all over the body and really ramping up the body's immune system to a point where it starts attacking the wrong tissue. And so some of that we are seeing, as you're saying, blood clots, both in the lungs and other parts of the body.
And we're seeing it take a lot out of people that they have to go to rehab and spend several days in rehab just to get their strength back and get their functions back, because it is so debilitating on the body, as Dr. Willoway has said.
Now, Rick, I want to ask you this question, Mr. Stevens, that with the rehab, do some people have to rebuild or strengthen their legs to be able to walk as well? Have you heard of any case like that?
It's all the above.
Oh, really?
Strengthen the legs, strengthen the arms, just to get your breathing back. And Dr. Wellaway probably could speak more to that than I could. But it's all of that because it just takes you out.
Now, just out of curiosity, what is the oldest patient have you seen with COVID-19 and to the youngest patient?
So I know we were talking not too long ago. We had a patient discharged from the COVID unit and also from our rehab unit who was 101 years old.
101?
101. So that,
Just last Friday.
Wow. That's tremendous.
yes, we were very proud of that.
And what is the youngest you would say you
The
had to care
youngest
for?
have been early 20s, 21, I would
Really?
say. Is the youngest
Very
of our
We
good.
had a young lady in her 20s that was discharged today who had lost her mother to COVID, and I think somebody else to COVID as well. And she was just discharged today. So the age range, you can see there's a big span in the age range, but it's affecting families as well.
So is there, when we first heard about COVID-19, it more or less implied that if you're 65 and older, you're a risk factor. Have you seen that being true, or is it more just spread out over the ages?
So definitely 65 and above, we're still seeing more patients coming into
Okay.
the hospital with COVID. But it's not only our older population, and I think that's something that is important for everyone to understand. As President Stevens said, we're seeing people in their 20s and their 30s, both coming in, staying for a few days, doing very well, and younger patients even requiring the breathing machine or ventilator.
Okay, very good. Now, everybody, as you see, again, we're wearing masks again tonight. And I want to ask Dr. Wellaway about the fact of the importance of wearing the mask and when should we wear the mask?
So we recommend that people wear masks anytime you're going to be around other people. And the reason is it decreases the spread of the virus. We know that up to 80% of people who have this virus may not know. They may not have symptoms, they may have very mild symptoms that they may be attributing to something else even. And so wearing a mask prevents those respiratory droplets from getting on anyone else and infecting someone else.
Okay. Now, the
We've
rest
gone to universal
Yes, sir.
masking at Christian and the BJC facilities. So if you come into the facility and you don't have a mask, we will give you one, but you will also see every employee wearing a mask at Christian Hospital and all BJC facilities as well. So that's how important the masking piece is, as Dr. Wellaway said, to stop those droplets from getting out into the air if you are sick or if you are asymptomatic or symptomatic and you don't know it just yet. And so I know there's a big controversy going on right now, and people are saying we're imposing upon their freedoms, but think about it, you wear seatbelts. It's a law. You have the option not to wear it. You can get a ticket for it, right? And there are some other things that, that we do that are laws that we don't like, but it's there for our protection. And it's shown seatbelts save lives, and so mask as well can save another person from getting sick and potentially your life as well.
Good. Excellent. Question. Right now in the St. Louis City and St. Louis County, as of May 18th, there's a laxing of the restrictions. And we were noticing with restaurants and other different entities that are allowed to reopen, that they are also being very cautious. Some of them are very cautious to reopen very slowly. The question I have is that with the relaxed restrictions, what can we do to make sure that the virus does not resurge?
We think it's very important for people to do the basics. Wash your hands, cough into a tissue, throw it away, wash your hands. If you feel sick, don't be around other people. But also wearing a mask, as President Stevens just discussed. Social distancing, so being 6 feet at least away from people around you. Those are things that are going to help protect you when you're back out in the community.
Okay. Rick, anything you want to say, sir?
No, I think those are all good things. And again, if you have the symptoms, such as coughing and loss of sense of taste or smell, or all the other achy body, feeling achy in the body, and the other symptoms that are out there as well, get tested. 314-653-5000. You can call to be screened to be tested at Christian, and then you will know to self-quarantine, or you'll know your next steps of what you need to do as well. So the symptoms will stay the same, right, Dr. Wellaway? And so we've talked about those before, but that's what I would say as well. Just be cautious. It's not going. The virus is a virus. It doesn't go away. Right. The flu is a virus, right? It's not gone. It's never gone. It's not gone away. A cold, is that considered a virus as well? It's a virus as well. It's not going away. This is with us, but we have to have caution as we go forward.
Okay. Now, I would like to go back to one thing that you said about symptoms. Right now, we're in the springtime and things are coming alive. There are the allergy sufferers, those with sinus issues, and there's those with drainage problems, and they're coughing. The question is that what would be the symptoms you would advise someone if they should really, one, either get tested or just go right to the emergency room?
So that's something that we hear a lot about too, is this is the season, as you said, for some of these symptoms to be happening anyway. What we notice though is people who have COVID-19 are more likely to have fevers than anyone with allergies. So most of the time your allergies are not going to come with a fever, especially not a high fever. So if you're experiencing a fever on top of some of these symptoms, as President Stevens discussed, being very achy, I mean, we're seeing people that are young, normally able to get around, have a full-time job, that can barely get out of bed. That's not your usual allergies.
Okay. So therefore, when a person has a fever, if you feel like not getting up out of bed, just kind of feeling really weak, and you probably need to go and get checked.
Yes.
Okay.
And in the meantime, take your allergy medicine too along the way. Whatever your allergy medicine is, your nasal spray, and those types of things as well.
Okay. Very good. Very good. One question I hear a lot of people asking is this. Someone had COVID-19. What is the probability that they will get it again?
Another good question, and one that we don't really know the answer to that. So we've seen patients come in diagnosed with COVID that are mildly sick, maybe need some oxygen for a few days, get better and go home. We've seen patients on the ventilator for a month. Some of them get better and go home. And we've seen some people come back. And so it's difficult to tell whether they got rid of the disease, the virus, they shed all the virus and they're no longer contagious and they picked it up from somewhere else, or if they still had the disease and it was dormant or not active and then all of a sudden started back up again. So we're not clear as the medical profession yet on that.
Have you experienced any patients coming back, or you have?
Yes, we have. It's interesting. We've had a few patients with very mild symptoms, kind of don't feel like my normal self. They come in, they get tested. Some of them have left from the ED. And a couple of weeks later, then they're starting to have trouble breathing and have come in. Some have found, like you talked about earlier, blood clots in the lungs or kidney issues. So yeah, it's been very interesting. Typically, someone will start to feel symptoms about 6 days from the time that they were infected or contracted the disease, and things start to improve over about 14 days.
Okay. So therefore, would I be correct in saying or wrong in saying a person, those that probably have returned over those that probably came at a very, very early stage, hard to detect, but then as it developed, they had to come back?
Yeah, that's a really good way to put it too, because one thing we're also seeing is people who were initially negative. I was tested a week ago or a month ago, and I'm fine, and they come in not feeling well, and they test positive.
Okay.
And it may be that, as you just said, that it's too early. They weren't shedding enough virus to be picked up in the test, and now they are, and now they're positive.
Okay. Great.
No, I have nothing to add to that. Those are all good points.
Okay. Now, the President of the United States has been giving medical advice about one drug, hydrochloroquine. That's a drug that he recommends, he's using himself, that people should use in order to prevent getting the virus or to heal from the virus. Is there any scientific data to support that or not?
Another good question. So, no. The quick answer is no. This was a drug early on, both when the disease was just in China, when it was hitting Spain and Italy, even in Washington State, where it started here in the U.S. I was hearing from some of my colleagues in Washington, some in Michigan, some in New York, that we think this drug might be working. There were patients that received that drug in this community as well, or in St. Louis, because that was the thought. But as more studies were being done to look clearly and see, let's look at the people who got it, let's look at the people who didn't get it, and what's the difference, it was found that, number one, there was not an improvement. So it's not that people died less. It didn't show that people even cleared the illness sooner. And what it did show was some issues with heart abnormalities, because we know that drug. And just a little more about the drug, hydroxychloroquine is a medication that has been used long before COVID-19. So it's used to treat malaria, it's used to treat lupus in some patients, and arthritis, rheumatoid arthritis in some patients. So it's not a new drug, it has indications, but what we've seen so far through several studies all around the world is that it doesn't treat COVID-19. There are still some studies looking at just that. Can it prevent COVID-19? We do know there were some unfortunate cases where patients who didn't have any symptoms took the medication and unfortunately died of heart issues. So we are not recommending that patients take that. We're not giving that medication to patients for the treatment of COVID-19, but as I said, there are some studies that are still looking at that.
All right, thank you. Now, there is another drug, hope I pronounced correctly, remdesivir?
Remdesivir, yeah.
Okay, good. It's supposed to shorten the stay for the patient with COVID-19. Could you all explain that to us, please?
Well, I'll start and then Dr. Wellaway can finish. You're absolutely right. The studies have shown that remdesivir can shorten the stay for COVID-19 patients. And so at Christian, we have gotten in a shipment, and so we are using it on certain patients that have agreed to that. And so Dr. Wellaway can say where we're at with all of that, because it just started, so from that standpoint.
Yes, so this is a medication that's been around at least since 2016. And it was initially created to treat Ebola. So after the big outbreak, people were concerned and looking for something that could treat the disease. And so that's where it came from. And then in 2017, they started looking at different coronaviruses. So COVID-19 is a coronavirus. There are lots of other coronaviruses. Many of them usually affect kids. They feel ill for a little while, maybe some nausea, vomiting. They get over it. And that's been the coronavirus that we're used to. So they were looking at those type of viruses and noticed that it seemed like it was stopping the replication of the virus. So if you stop the virus from reproducing itself, then you effectively slow the spread of the virus in the body and you get over it quicker. And that's what some of the studies have shown since it was in China, again, similar to hydroxychloroquine. I was hearing from colleagues in Washington about this medication in January too. And this one seems to be panning out. We're seeing patients getting off the ventilator. One of the largest studies has shown that about 13% of patients were clinically improving. 13% of patients died, but that's compared to 70% of patients that are on the ventilator, and some other studies have died. So that's a significant improvement, and that's what we're looking for. We do have patients at Christian that are currently taking the medication. Now we have a few on our service that are doing well, so we're watching.
Okay, very good. Ricky, anything else you want to say, sir?
No, we're one of 18 hospitals in the state to have received remdesivir because of the high number of COVID patients that we have seen here in North St. Louis County.
Christian, as you stated, is one of the 18, and you guys have been doing a tremendous job from everything I'm hearing, how you're treating the patients. And so I commend you very, very much for that this community has this hospital in this region. I have a question. COVID-19, we always hear about the worst cases. And we know about maybe, what was it, 80% may not know that they have COVID? Do I have that correct or incorrect?
Yeah, so about 80% of patients, and that's looking at what they were seeing in China, in Italy, and Spain, and between 50 to 80% from what we're seeing even here in the US so far, of patients that have the disease are fine. They're not coming to the hospital. So we're seeing a very small percentage of people who have COVID-19 who need a hospital. Yeah.
Now, some people you hear will complain and say, even of all the tens of thousands of deaths that we've had in this nation, they say when you compare it to the population, it's a small number. But at the same token, that's a lot of people dying in a very short period of time. And then people are clamoring about, they want their freedom back. But is it safe to say that the reason why the curve has flattened or is flattening is because of the process of social distancing? That would have saved now maybe hundreds of thousands of lives. And so would you like to speak to that?
Well, the social distancing definitely has been a key factor. I mean, it's kind of like I gave that example a few weeks ago of the matchsticks. You know, the wooden matchsticks. You light a matchstick, the next one gets on fire, the next one gets on fire. But if you pull one out, then the fire stops at that last matchstick before it could jump over to the next one. And so the evidence has shown that the social distancing has worked. And if we had not done it, I mean, you look at Brazil right now. Brazil is leading the world in the number of cases right now. You look at Sweden, they're trying to say herd immunity, but I understand with herd immunity, you have to have a vaccine for it to be effective, and we don't have a vaccine yet. So taking people out of the system, taking people from being around each other definitely has worked, and that's been one of the key factors to help us here. in flattening the curve, and then, like you said, not to have others die as well. I don't think it's a badge of honor to have as many people get the disease as we've had, and to have as many people die when a lot of this could have been prevented if we would have just paid more attention and listened to the scientists and listened to the doctors. I know a lot has changed since we started. I know Dr. Wellaway was telling us about this, and things were happening, and we were trying to understand it. I was trying to understand it as well, and so now that we've gotten a better understanding of a lot of this, we're trying to move forward and do what's best. And so, not everybody we didn't have the mask to wear, but now everybody's wearing the mask. And so now we're, seeing more and more of how we can stop a lot of these things and prevent it, in the mask and the social distancing and the washing of the hands, and all those types of things are key. I think, Dr. Wellaway, you mentioned that you saw your colleagues in Michigan saw some people get sick all of a sudden, and they did some contact tracing, and they asked, where were you at? And they were at some of these rallies. And if you notice at some of the rallies, people aren't wearing the mask. And so those individuals have gotten sick as well from those rallies as well. So.
Thank you. Doc, anything else you want to say?
I agree.
Okay, let me ask you this question, because we know the COVID-19 impacts the respiratory system. And we talked about it briefly before, but this virus not only affects the lungs, it affects the heart, the kidneys, there's blood clots in the lungs. Can you just kind of explain to everybody what makes this virus so different? How it will attack the body?
Yes, and this is something that we're learning every day. Initially, in listening to some of my colleagues around the country and around the world, that was one thing that kept coming out, is this is not the flu. This is, even the pneumonia that you get from COVID doesn't look like a pneumonia. We call it ARDS. That's a disease where both sides of the lung are completely full, and people struggle to breathe. A lot of those patients are on the ventilators, but it doesn't act like normal ARDS even. I mean, it's been confusing for the medical community. But one thing that we are seeing is the body's immune system, so your cells that are supposed to be fighting off infection, are getting ramped up by this virus. And they're running around and wreaking havoc, really. And they're setting off the coagulation, we call it, but basically the clotting cascade. And so it's causing clots to happen in people who don't have any reason to have a clot. You mentioned the lungs. We're seeing this in the kidneys. We're seeing this in the brain. So it's showing up as people passing out, seizures, strokes, confusion. We're seeing it in the heart. People are coming in with heart failure, coming in with heart attacks. We're seeing clots in the legs in some patients. Some of these patients, as I said earlier, are not showing up with respiratory symptoms. They're coming in with stomach pain, nausea, vomiting, diarrhea. Sometimes that starts before the breathing issues. We're seeing in our diabetic patients, some of them coming in with blood sugars in the 400s, 600s, and they've been taking their medicines normally. So the virus is doing a lot of things that are not consistent with some of our previous viruses that we know and treat well.
Now, is this virus abnormal to other viruses for how many parts of the body it attacks?
That's good. It is. It is for us and for what we are used to, I should say. So people compare this to the flu. And I think initially that was a lot of what was happening, as people felt like, well, this is another flu. This is only in China. Do we need to worry about it? But it's not that. It's not the flu. It's not like other coronaviruses either. It's just very different from anything that anyone has seen in recent history. And that's what's making it so difficult to treat and to diagnose for some people.
Okay, now when it attacks the other parts of the body, the different or organs, does it cause permanent damage, or is it just during this time frame of being ill and then the body heals itself? Or like for instance, with pneumonia, there's a virus that goes with it. The hearts could go into AFib. Is this permanent damage by this virus?
That's an excellent question. And to be honest, we don't really know. We know that people are getting better. Most people that are coming into the hospital are leaving the hospital. Even around the country, we're seeing, again, some young patients in their 20s, 30s, healthy, otherwise no medical problems, that are coming in, being taken out by this virus, needing rehab, going home, and slowly trying to build their lung capacity back up. So we don't know the long-term effects of this disease yet.
Well, thank you. Rick, anything you want to say?
No, I can't add anything to that.
Okay, now, once again, with the city and county relaxing their restrictions, what would be the indicator to the scientific community that the virus is beginning to resurge? What would be the things you'd be looking for?
Well, I think you would see increased hospitalizations, because that's what we're looking at now. Increased number of patients that have COVID that are in the ICU as well. And then just overall an increase in the number of individuals that have COVID. Anything you'd like to add, Dr. Wellaway, to that?
Yeah, no, I think you're spot on, and that's what our partners, both at BJC as well as SSM, St. Luke's, and the Mercy system that you all have probably seen on the news, they're tracking that, and they're looking for all of those things. How many people are in the hospitals? How many people are in the ICUs? How many people are on the ventilators? In some states, there's discussion about looking in the sewage system, because the virus can be shed all different ways. Are we seeing more of the virus in the sewage system? So at this point, the best indicators are hospitalizations.
Okay, so if the bed count for COVID begin to increase at a rapid number, we know then we would know then that there is probably a resurgence taking place, which then means that the community needs to make changes in behavior. If they apparently stop social distancing, need to go back to social distancing. Now, I got one more question I was curious about. When you're discharged from the hospital with COVID-19, a lot of times when you're in the hospital, you leave, they have some medication. They may say, you should take this, or is there anything like that with COVID-19, or when you're out, you're out?
It's a really good question. So we are treating patients with medication. So we talked about hydroxychloroquine we're not using. Remdesivir we are using now that we have that, and we're happy about that. Some patients are getting steroids. Some patients are getting blood thinners, as you talked about, the clotting issues. Some people are leaving the hospital with oxygen that didn't come in using oxygen. And we are doing follow-ups. There's a great post-discharge program at Christian where you can be linked with a healthcare provider. They will send someone to your home, watch your oxygen level, and that would trigger a call or, hey, we noticed this, or your heart rate is looking like this. Well, how are you feeling? So there are eyes on. We have our primary care doctor community that is eager to see these patients and follow them closely as well.
Okay. Now, do patients go home still taking an antibiotic with COVID, or is that not necessary?
It depends, and it depends on how long they've been in the hospital. Because the
Okay.
treatment course for many of these drugs is 5 to 10 days. Some of the blood thinners, depending on some of the markers, again, with the immune system all ramped up, if we're still seeing those numbers high, they will discharge with blood thinners as well. And we're asking people to quarantine when they leave the hospital if we know they've had COVID. So not to run back to your community, stay away from family members, wear a mask when you're around, use a different bathroom if you can. And to help with that, we have the Quality Inn down the road that's being run by the state and the National Guard to have people stay there after they leave the hospital until that period of time has finished.
Now, I'm curious about something, about the antibiotics. I was told, don't know if it's true or not, that probably the strongest antibiotic that is used is the liquid version of Levaquin. Is that true or not? And is that the antibiotic that you use for COVID-19?
So initially, when we were treating COVID, and I say we as the medical community, we were looking at the hydroxychloroquine. We were also looking at azithromycin, which is an antibiotic that we use to treat common pneumonias for community-acquired pneumonia. But that combination, again, was causing heart issues, so we stopped that. And we're not really treating people with antibiotics if they only have COVID. That being said, we are seeing patients that are coming in with COVID and other bacterial infections because antibiotics do not treat viruses. But again, we are having people with bacterial infections, and those patients will be on antibiotics.
Okay. Ricky, anything you want to say?
Nothing to add, no.
Okay. Let me ask you this question. Going back to something the pre-existing conditions that apparently is cause for the disparity of African Americans dying to this disease. And as you said, some people may come in not just with COVID, but there's other things that are going on. The question is, with pre-existing conditions, are we speaking of pre-existing conditions where they're not getting medical care prior versus someone who has pre-existing condition, but they're seeing a doctor, they're on medication, and they're pretty well stable? I'm assuming the one that has the most difficulty is the one who does not see a doctor and does not have the medication whatsoever to be stable to function in life. Is that true? Or?
Yeah, so you're right. We are seeing patients and still seeing the older population and patients who have comorbid conditions. So that's your diabetes, heart disease, heart failure, high blood pressure, high cholesterol, COPD. So those are common in society and common in the community. Patients who have those issues are more likely not to do well with this disease. Not that they're more likely to get the disease, because the virus is, as President Stevens says, doesn't care. I mean, it's going after everybody. But those who are not doing well are those who have these conditions. Now, of those patients, obviously the ones that are better controlled, so watching their blood sugars, making sure that they're keeping them where they should be, taking blood pressure medication, cholesterol medications, that's going to put you in a better position if you get this disease than if you're already have some of these numbers and disease processes out of control.
Okay. Now, the question I'd like to ask, Rick, is that, once again, we're going back to the relaxing the restrictions in St. Louis County and city. I've heard some people say, okay, by doing so, we can expect a second wave. Could you maybe tell me what would be the, could you explain to me why it's thought that we could have a second wave just by relaxing the restrictions?
Because I think, it's natural for humans to go back to doing what you were doing before for so many years. And so I think also the thinking is that we would put our guards down as well, thinking, oh, we relax the restrictions, everything must be okay. And everything's not okay because the virus is still with us. And matter of fact, not only a wave now because we're relaxing the restrictions, and I hope we don't get a wave, but the talk has been later on this year, in the fall, when the flu season comes back around again, that it would come back again and be stronger there as well. But the thought about a second wave now is because relaxing the restrictions, people gathering around each other. I was looking at the news before I came, and I think it was in Colorado at this little river or something, and they just had people just all over each other, right? And they weren't even 6 feet apart. And so they have since closed that little area down. But you've probably seen on TV as well, people are not adhering to the 6 feet apart and the social distancing at some bars. And you look at the younger generation, the invincible, the teens and the people that are in their early 20s, thinking I'm invincible, it's not going to affect me. And so it's just that whole adherence. And then you have the whole thing of, saw again on the news, somebody at Costco didn't want to wear a mask and just saying it was imposing upon his freedom not to wear a mask. But nonetheless, though, it's just human nature. And we want to gather, we want to be around people. And so we're watching it very closely. We have seen a little tick up within the BJC facilities, but overall for St. Louis, we've seen it going down. But I mean, it's something to be watched. And we know we have to live with this virus, and hopefully sooner or later we will get a vaccine as well that will be very effective. And in the meantime, we'll hopefully have some drugs like remdesivir or some others as well that can help as well.
Now, the question I have to ask is that regarding the vaccine, that the vaccine, some say we might see one early 2021. Is that what the science community is hearing or not?
Yes. So I know there's a lot of talk about a potential by the end of the year, and we are all hopeful for that. Just to put things into perspective, the usual course is 10 to 15 years. So a few things that would accelerate that, and we do believe it will be sooner than that, is the fact that there are some areas, some labs that were already looking at some coronaviruses and creating vaccines for coronaviruses. And so the hope is that they can adjust one of these drugs that they've been working on for this disease. And so that is why we're so hopeful that we will be receiving one very soon. But as President Stevens said, it's important that it's useful, it's helpful, it's going to attack the virus, it's not going to harm people. And so there are several clinical trials going on around the world to find a vaccine to do just that.
Okay. Rick, anything you want to say about that?
No, I hope that we can get a vaccine quick, though, so.
Yes, sir. Now, but I want to ask you this one question, because in New York, I guess a week or two ago, we saw a phenomenon take place where children were becoming ill, which is said to be related to the coronavirus, called the Kawasaki disease. Could you please share share with us what is the Kawasaki disease, and how should a parent take note if they think a child has it?
Yes, so I'm an adult doctor. I'll start by saying that. But yeah, Kawasaki's is actually one of the more common types of vasculitis, we call it. So basically, it's something that attacks the vessels, and the vessels get very small, or large in some cases, but usually very small. And it's almost like they've clotted off, causing issues downstream from where that vessel normally is. The reasoning for that is that same process of your immune system going haywire. And so that's what we're starting to see in the young children. So Kawasaki's and coronavirus, they look very similar in kids. Usually it'll be like pink eye, the white part of the eye will be a little red. They'll have, we call it strawberry tongue, because the tongue is bright red. Some patches, red inflamed patches on the skin. Those are some of the common causes. Kids may feel tired, listless, not their normal selves, not really as active as normal. Some may have abdominal pain. Occasionally, some will have respiratory issues like cough or things like that too. But those are the presenting symptoms, and those kids are being found to have COVID-19. Most kids who have Kawasaki's get over it within 7 to 12 days. There are some severe forms where kids can have issues with the heart, and that's one of the big things that we get concerned about there. So if your child is exhibiting some of these symptoms, definitely call the doctor, get in to see them. I know there are televisits as well as in-person visits around the city now too.
Is there a cure for Kawasaki disease?
Cure. So most times it goes away on its own. For the more severe cases, the treatment would be somewhat similar to what we're trying to do with COVID-19. So drugs that suppress this immune system, steroids, that's a lot of the treatment.
Okay, very good. Now, is the virus found in the urine? I'm sorry. Is the virus found in human urine?
Oh, yeah, that's a really good question. So we know it's in the stool, and so some people feel that maybe it can be spread if you don't wash your hands well and you eat something after using the bathroom. Could you spread it to someone else? That's really not clear at this point, but people are seeing the virus in the sewage systems. And the thing about that is we don't know if that's active live virus or not. Urine is unclear too. Yeah, I haven't seen a lot about that.
Now, another question I've heard, don't know if it's true or not, but is the virus found in human feces?
Yes,
Okay.
it definitely has been. The question is it active virus or inactive virus? And that's similar with patients who come in, they're positive, they leave, maybe they're positive again a couple weeks later. And so we're not clear because the test that we do to see whether you have active virus or you're infected can pick up potentially some of the virus that's not really transmittable. And so it may be just shedding that dead virus and not the active virus that could get someone else sick. So we don't know.
And that's why it's so important, as they said, to wash your hands and to have those sanitary conditions and to wipe things down, wipe your doorknobs down, wipe your door handles down, but then also just to be aware to continue to wash your hands 20 seconds and to have those good hygiene practices going forward, because the virus is in the urine and it's, the jury is still out if it's active or not active in your feces, but nonetheless, having those good hygiene practices is key.
Okay, I want to ask this one last question. With public places opening up and the virus could be found in human urine, we're talking about human feces. Public places have public restrooms. So people go to the restrooms, and sometimes people are not as tight as they should be. And also I'm hearing that the commode can be considered as an aerosol when you flush it and it sprays. What do you advise a person?
That's Good.
When you're in a public place, use the restroom and wait till you get home.
Solution number one. Wow, that I have not thought about that. But again, as President Stevens said, you can't beat washing your hands. Actually, washing your hands, soap and water if you have it, alcohol, if you have sanitizer, one thing that's really important about that is that you let it dry. So it's not working or worked until it's dry.
Okay.
But making sure, and when you get home, you're taking your clothes off, making sure that they're getting cleaned appropriately, and you're not kind of running around your house in something that may be contaminated. We've seen that the virus can sit on counters and doorknobs, as President Stevens said. Again, we don't know enough about it to know whether you can absolutely get it that way. We know you can get it from even talking closely to someone, singing, coughing, obviously. So just to be on the safe side, wash your hands as often as possible. Clean your clothes when you've left. Clean your shoes. I think the shoes is another thing that people don't really think about. But maybe leaving your shoes out before going into the house if you've been out.
Very good. I want to ask you both one last question, or rather, I'd like to give you a chance to just kind of tell everybody, to advise everybody what we should do, because many people I know want to get rid of the mask and they want their freedom back to do what they want to do. But the reality is we're wearing the mask and wash our hands and sanitizing ourselves. One, yes, protect our own health, but also to protect our families, our loved ones, and our friends. And we'll be doing this probably until there's a vaccine. Would you like just to speak to everybody and give them whatever advice you want to give them, what they should do to stay healthy?
Well, I think it's a lot of the things that we said, and as Dr. Wellaway said, the hand sanitizer, washing your hands, wiping down counters, wiping down bathrooms, taking Clorox wipes or whatever it is, disinfectant wipes with you, maybe if you're going to be out and you have to use a public restroom as well. Wear the mask. It also keeps you from touching your face as well, right? Because if you touch your hands, and I understand the transmission is through your mouth or touching your eyes and through your nostril as well. So those are all protective things. And so I know it's a new normal for a lot of people, and people are saying, you've taken my freedom away. But this virus is real, and this is not something that's made up. It's not a hoax. Dr. Wellaway sees more than I see of people that actually have the disease and what it's done to individuals that have had the disease. We've recovered a lot of people, but it's debilitating. People have to go to rehab if they have the disease as well, and we don't want people to be sick. We want people to be healthy, but we're here for you as well, and that's why we put out these preventive measures. I go back to the seatbelts as well. Seatbelts do save lives. I'm pretty sure you've heard people who've been in accidents and they said, well, they didn't have their seatbelt on. They were thrown from the car. I know some people don't like to wear seatbelts, but we wear them to save lives. And so the mask, the washing of the hands, the social distancing, going to get tested, those are all things of where we're at right now. We're not saying we have to be like this forever, and there is no economy if we don't have people. So people make an economy. And so we want people to be alive to make the economy for this great country that we live in as well. So those are some of the things that I would have to say.
Doctor?
I would echo everything that President Stevens said. We hate the mask too. It's not fun for anyone, but for all the reasons that he just brought up, it's important. I think another thing that I would like to say is for our non-COVID patients. So we're hospitalists. I'm a hospitalist. We see patients that come into the hospital all the time. We're concerned about the patients that we haven't seen in a while. So COPD, heart failure, history of heart attacks, diabetics, some patients that can get into a bind even when taking their medications, or those who are not taking their medications and have to come into the hospital to be treated. We're not seeing as many of those patients. We like to hope that they are doing well and that they are safe and they are social distancing and masking. But if they're not, we definitely want to see them. So what we don't want is for people who should be coming to the hospital not to come in.
Right.
I think Christian's done an excellent job of taking care of those patients, both that have COVID and don't. We have separate floors for patients who have COVID and those who don't. So definitely, if you need to come in, we're here for you.
And the hospital is very safe. As I mentioned before, everybody is wearing a mask. We will give you a mask. But we're also taking everybody's temperature. The staff is getting their temperature taken, and all the guests and the patients are getting their temperatures taken as you enter into the facility as well. And some patients that are having surgery are getting tested for the virus as well. We're wiping down surfaces more than we've ever done before. We were doing that before, but we're doing it even more now. Our sanitation is above par. We use all hospital-grade disinfectant. You even hear the airlines saying we're using hospital-grade filters or hospital-grade cleaning agents as well. So our cleaning, our sanitation practices are good, and the hospital is safe to come, because to Dr. Walloway's point, we're seeing people stay away from the hospital, and they come to the hospital and then they're maybe collapsing right then and there, and they should have come maybe 2 or 3 weeks ago or a week ago or whenever. Come to the hospital, follow up on your doctor's appointments. The hospital is safe to come to.
Thank you, thank you. I want to tell everybody, I want to thank you for taking the time to watch tonight, and I know we've asked a lot of different questions, and some great answers are being given by health professionals. These are professionals, and they care about you. They're here because they want our community, they want our society to be well and healthy. And I hope you listen to what was said tonight, and you take heed to it, and you share it with your families and friends. For instance, if you need to go to the hospital, go, my friend. Don't wait until it's too late. Go when you need to. If you got a doctor's appointment, don't just cancel it. Maybe do a televisit, but whatever, still keep your appointment, because your health is a precious thing to have. And I just want to encourage everybody, as we go through this time period wearing our masks and washing our hands, we're also doing this because why? As the Bible says, love thy neighbor as thyself. I want to make sure my neighbor is kept healthy as I am healthy. So I pray for each and every one of you that let's walk in health, walk in strength, and let's do our part in our community, make it strong and healthy and sound. I want to say a prayer for you as we conclude. Dear Father, in the name of Jesus, we thank you now for those that have watched this evening and listened to this information that is vital for our lives. I ask you, God, to bless them to take this with a seriousness and to share it, to be the evangelist of health. So, God, that men and women, boys and girls can have the practices of life that will protect their health, that they may have a good quality life. Bless each one, God. In the name of Jesus, we pray. And the last thing I want to say to you is this. It is census time in the United States of America. To complete your census. Because if you don't complete your census, you may hurt your community and not get the dollars that should be coming to it from the government. So be counted. God bless you, love you to life, and have a great day.